In this video you will learn how to scan for oral sleep appliances. This workflow shows how to scan using the TRIOS scanner to get the best results for oral sleep appliances. Before you proceed, please set up the connection to your sleep appliance provider within 3Shape Communicate and make sure that their lab is available in the order form step. Start from setting up the case. Select the New Patient tab or choose the patient from the list and create a new case. In the Send To page, select the chosen oral sleep appliance provider. On the order form page, choose Scan Only and click Next. Start by scanning the lower jaw, following the recommended 3Shape scan strategy, which is scan the occlusal surface from the molar to the canine. Wiggle the scanner when passing the centrals and continue until you reach the last molar. Roll over the last molar and turn slowly lingual until you reach the other side. Either use the tip to keep the tongue away or enable AI to suppress unwanted soft tissue. Roll over the last molar and scan the buccal area for the whole jaw. Inspect the scan when completed and move to the next step. Make sure to capture at least 5 mm of additional space between the margin line and the soft tissue. Move to the upper jaw and scan it following the 3Shape scan strategy. Start scanning from the occlusal surface of the molar to the canine. Slowly wiggle the scanner while passing the centrals and continue scanning the occlusal surface on the other side. Roll over the last molar and scan the buccal side until you reach the last molar on the opposite side. Then move to the palatal side, going along the whole arch. Scan palatal starting from the incisors and slowly go from side to side across the palate in the distal direction. Inspect the scan when completed and move to the next step. Make sure to capture at least 5 mm of additional space between the margin line and the soft tissue. Before you move on to the bite scan step, prepare your preferred bite method and follow the recommendations to set it correctly. Ensure a stable jaw position with a gauge or gig in the therapeutic bite position. Leave 3 mm jaw space between the arches. Leave 5 mm clearance between the two opposing anteriors, to a minimum of 5 mm. Make sure the scan exposes the canine region and the distal last teeth. When the gauge is in the patient's mouth, the jaws with the gauge need to be stable while scanning. Use the preferred bite method and remember to trim away unnecessary material, especially from the buccal side, so that the material will not cover the teeth. Insert the scanner carefully in the mouth and drag it to the side that you wish to scan. Scan the bite following the official 3Shape scan strategy. Try not to move the position of the inserted gauge. The scan should cover at least 3 to 4 teeth for a perfect alignment, even if the scans snap together earlier. The bite registration should be done on both sides. The bite will be aligned automatically. When scanning is completed, move to the validation page, where you can check the scans and if everything is okay. Post-process the scan data before sending the case to the lab. After post-processing, on the Send page, click the Send button to finish the order. Now you should know how to scan for oral sleep appliances. And thank you for watching.